Namaste. Good evening. This is Dr. Aparna. I am an Ayurvedic psychotherapist, an emotional healing synergist in my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally. I come up with discussions on Ayurveda, mental health, psychotherapy, and related aspects. Today, we are discussing ADHD, that is Attention Deficit Hyperactivity Disorder, in teenagers. If you have followed, if you have been following, we are discussing about adolescent mental health in the previous sessions, and we had also discussed on eating disorders in adolescence the previous session. So this session we are going to discuss what is ADHD and what does it look like in teenagers. Most of you might have heard of ADHD in children, but how does it manifest in teenagers or adolescents? So without wasting time, let's get started. So attention deficit hyperactivity disorder in teens is a neurodevelopmental disorder. So persistent problems with attention, hyperactivity, and impulsivity that continue from childhood and interfere with their daily lives in adolescence. So, onset. See, ADHD typically first appears in childhood, but symptoms can persist or become more prominent during adolescence. Core symptoms. The core, symptoms of attention deficit hyperactivity disorder in teens, there are two important, categories. One is inattention or lack of attention. So difficulty focusing, staying organized, and completing tasks. Next is hyperactivity impulsivity. That is restlessness, excessive talking, acting without thinking about the consequences. So when I say two, one is inattention, second is hyperactivity and impulsivity. So this how does this manifest in teenagers? So symptoms in teenagers may differ slightly, from younger children. So, for example, hyperactivity may become more internalized as excessive talking or racing thoughts. See, ADHD can significantly impact a teenager's life. It could affect their academic performance, their social relationships, and their emotional well being. So, it can also lead to difficulties with self esteem, anxiety, and depression. See, it is important that we know that ADHD manifests differently in each, different individual. So the diagnosis should usually be made by a qualified healthcare professional. So when I talk of ADHD symptoms in adolescents, first is in inattention. The first problem is daydreaming and difficulty staying focused in class. So their mind may wander frequently during lectures or discussions, leading to missed information and poor academic performance. Next is disorganization and forgetfulness. So they may struggle to keep, track of their assignments, deadlines, and belongings. So leading to lost, homework and missed, assignments or projects. Next is difficulty starting or finishing task. So procrastination, that is delaying tasks, and difficulty initiating tasks become more prominent. So they become more evident. They may start assignments but struggle to complete them due to losing focus or becoming overwhelmed. The next thing that happens is aversion to tasks requiring sustained effort. So, subjects requiring long periods of focused attention, like reading, homework, any project, become particularly challenging. So, these are the symptoms we see in inattention. In hyperactivity or in impulsivity, there is restlessness and fidgeting. I'll explain both. So, while less common than in younger children, some teens, may still exhibit physical restlessness. This could be there, this might not be there as well. Physical restlessness, like tapping their feet or constantly moving their hands, and they sometimes have self-focused behavior, so it can be difficult for a teen with ADHD to recognize what other people want or need. So they can have a hard time waiting for others or taking turns, so they will be more impatient. Fidgeting, see, and the next thing is restlessness is a common sign of, attention deficit hyperactivity disorder, but someone with ADHD might find it difficult to sit still without squirming or getting up. So that is fidgeting. So they cannot sit still, they will do some or the other activity. Next is heightened emotionality. So research suggests that people with ADHD may not reach the emotional maturity of a typical, 19-year-old or a 20-year-old till their late 20s or early 30s. So, adolescence for them is an emotional roller coaster. So, with ADHD in the mix, angry outbursts and overly dramatic scenes may play out in inappropriate, circumstances. So, they also have fear of rejection. That means rejection sensitive dysphoria is common in people with generally with neurodevelopmental disorder, especially in ADHD. So, high emotions can be triggered by rejections, teasing, or criticism. They could become highly sensitive or emotional, when they face rejections, teasing, bullying, or criticism. So, then there is internalized hyperactivity. That means this can manifest as excessive talking, rapid thoughts, and difficulty relaxing. They can't relax. So, impulsivity leading to risky behavior. That means teens with ADHD may be more prone to risky behaviors like substance abuse, reckless driving, or unprotected sex due to difficulty considering the consequences before acting. So, their impulsivity could lead to risky behaviors as well. Then, the most important thing is social difficulties, that is, impulsivity and difficulty focusing on conversations, can make it hard to develop and maintain friendships. So, they might interrupt others or blurt things out without thinking, so leading to social awkwardness. So, additionally, they might experience low self esteem. So, academic struggles and social difficulties could, lead to feelings of inadequacy and worthlessness. They could feel that they are worthless and they are poor. They know that because they have academic struggles and also social difficulties and difficulty managing emotions. They may struggle to regulate their emotions, leading to outbursts of anger, irritation, or frustration. They get agitated very soon because they have difficulty managing their emotions. And motivation problems, that means difficulty focusing on long term goals and challenges. They cannot focus on long term goals and challenges with planning. So, This can decrease motivation for schoolwork, college work, or future endeavors. So these are the symptoms what might happen. So now, because of these symptoms, what is the impact of ADHD on, the physical and mental health impact? See, the impacts of ADHD can be particularly challenging during adolescence. That is a time of significant social, emotional, and academic development. So they could have, on the mental health side, they could have increased anxiety and depression. See, the academic and social challenges associated with ADHD can significantly contribute to anxiety or depression in teens. And substance abuse. So, teens with ADHD may be more prone to self medicate with drugs or all, alcohol, to cope with the symptoms or emotional difficulties that they are facing. The next is eating disorders. So, similar to substance abuse, disordered eating patterns may be used as a coping mechanism, for the challenges they face because of the ADHD. The next thing is physical health. See, sleep problems such as, difficulty quieting the mind and staying focused. This can also disrupt the sleep patterns. So this might lead to fatigue because of their mind, being disrupted continuously. So they might feel fatigue, and it also could impact their daytime functioning or productivity. So the next thing is increased risks of accidents and injuries. So impulsivity and restlessness can lead to risky behaviors, so by increasing the chance of accidents and injuries. So, and they could also have headaches and stomach aches. So stress and anxiety associated with ADHD can manifest as physical symptoms. The next thing is, the important thing to remember is, see, early diagnosis and treatment can significantly improve, a teenager's life and help them manage their ADHD effectively. So how can parents support, teenagers with ADHD, because they face unique challenges? First thing, we'll discuss about parents, teachers, and the school system. But today we are going to discuss about what can parents do, parents' role. So, first thing is education and understanding. So, learning about ADHD or being aware of ADHD and its specific manifestations in adolescence is crucial if you are suspecting ADHD in your child. So this empowers parents to provide, if effective support and advocate for their child's needs. The next important thing is open communication. So maintain open and honest communication with your teen about ADHD. So discuss the challenges they face, and the work together, to develop, coping mechanisms. The next thing is positive reinforcement. Focus on praising positive behaviors and effort, not only the rewards or their achievements. Celebrate their efforts and accomplishments, no matter how small they are, to boost their self esteem. Because they have low self esteem, positive reinforcement from parents will help. Praise them, reward them for a good behavior, or for a good effort on doing something. This next thing is structure and routines. So this is important. Establish consistent routines and structures at home. That means plan, they should have a routine. So this provides a sense of predictability and helps manage time effectively. So breaking down large tasks into smaller tasks, prioritizing the task, and making it more into more manageable steps. So you may have to help them to structure their routines. The next thing is organization skills. So help your team, your teen develop organizational skills. That means use planners, use calendars, use visual aids like checklists, to keep track of assignments and deadlines. So you have to, help your team develop the organizational skills, to make checklists, to use planners, to use calendars, to use visual aids, to use vision boards, goal trackers, all of them. Next is healthy habits. So you have to promote healthy sleep habits, a balanced diet, and encourage them to exercise or get involved in some kind of sports. So these, all these will significantly impact their focus, mood, and overall well-being. And next important thing is collaborate with the school teachers and collaborate with the school. So communicate openly and regularly with your teens teachers. Share the diagnosis information and work together to develop a plan to support their learning in the classroom. So all these are the things which parents can do to help their teens, who are suffering with ADHD. So this is for today, and next in the next session we are going to discuss what is the teacher's role and what are the therapies which can help ADHD in teenagers and related aspects. So, thanks for watching, and you can post in all your queries, your thoughts, if you have experienced, if you have teens with ADHD, if you want to share something with us, please do feel free to, share that in the comments section. And thanks for watching. Namaste.